Long time, no vlog, and high time for an update on the medical project in Kukuo. So I'm here with Rebecca Czekalski, the nurse and HSC volunteer who's in charge of the medical project. And I'm going to let her give a quick overview of the project for everyone, those who maybe haven't been watching or don't remember the exact details. No matter what, it's a good opportunity for us to give a little summary. So what's going on with the medical project, Rebecca?
Okay, so the medical project, we are going through all of Kukuo village and we are doing a free health screening and health history taking of all of the people in Kukuo village. So we're getting all of their health history, anytime they've been to the hospital, any hospital medical record numbers that they have, their insurance status, their age, their date of birth. We're also actively screening for diabetes, tuberculosis, and malaria, and we're checking all children under the age of 5 for malnutrition and for their vaccination status.
Now, free healthcare is free healthcare, but why is that significant for this community, would you say?
Well, this is a community that has high rates of poverty, and they also have very limited access to healthcare. So the Tamale Teaching Hospital comes through about once every 5 years and does a health screening, but the patients are not given access to that information, and the Kukuo Health Clinic is not given access to that information. So there's very limited understanding of health conditions within the community, and there's also very limited access to healthcare because there's very little that the Kukuo Health Clinic can actually treat on site. Mainly malaria and minor injuries. Everything else has to be transferred 45 minutes away to the Bimbala Hospital. Unfortunately, most people don't own a motorbike, and most people who are sick are not able to be transported by moto. So there's really, it's a big issue trying to get people to be able to go up to Bimbala and to be able to be treated at the hospital. Also, Bimbala is under a 6 p.m. to 6 a.m. curfew, so if it's between 6 p.m. and 6 a.m., there's no hospital in this region.
No emergencies between 6 p.m. and 6 a.m.
Exactly.
Schedule your emergencies. So what has the Medical Records Project accomplished so far?
Oh, we've been busy. We've been screening about 2 months, and so far we have 595 screens fully processed and another 25 waiting at the printer. So when I say fully processed, after we take the health information in the local language Dagbanli, we then translate it into English. Both the English and the Dagbanli copies of the screens are then taken to the printer, and we make copies for the patient, which is given to them in a waterproof folder, for the Kukuo Health Clinic, which is stored in hanging file folders in a filing cabinet there. A copy is made for the Tamale Teaching Hospital, and then the originals with the consent form is stored at Songtaba office in Bimbala just in case anything gets lost or damaged in any way. So we have 595 screens processed, which is just about 50% of the community right now. We have done 222 malaria tests. Of those 222, 50 were positive for malaria, and those people have been referred to the Kukuo Health Clinic for treatment. We're trying to make sure that we don't set up an alternative system to the Ghanaian health services, but that we actually go through the system that exists and triage patients into the existing system so that there is a record of their disease and their treatment. We've identified 16 cases of hypertension. Some of them were actually severe hypertension to the point that after we triaged them to the Kukuo Health Clinic, we also transported those people up to the Bimbala Hospital so that they could be treated immediately. We've identified 41 cases of tuberculosis symptoms. Unfortunately, we cannot actually test the sputum at Kukuo at this time, so I am working with several different charities and the Ghanaian Health Service to try to figure out a way to get a mobile screening for tuberculosis to be done in Kukuo for those people. We have 71 cases of malnutrition that we've identified throughout the community. For those who are children under 5 with a middle upper arm circumference of less than 12 centimeters, they can be treated, but everybody else, they just get told to eat more. So we're also working with the councilman to try to find sustainable ways to increase the food that is available to people in Kukuo. We've identified 17 children who missed some of their vaccinations in their first year of life. All 17 are under the age of 5, so they can, once they're triaged into the Kukuo Health Clinic, they can actually get their vaccinations and get caught up. We've done 3 diabetes checks, and one of those was positive for type 2 diabetes, so we were able to transport that woman, triage her through the Kukuo Health Clinic, and then transport her immediately down to the Bimbala Hospital so that she could start treatment. We found one sweet little old lady who had fallen 4 years ago and broken her hip. And it hurt too much to be able to stand or to walk, so she was never able to get to Kukuo Health Clinic, and she was never able to get down to Bimbala to be x-rayed or up to Tamale to have hip surgery, so she's just been sitting in her front yard for the last 4 years. So we've been able to refer her to get evaluated for getting a hand crank wheelchair so that she'll actually be able to get some mobility back. And we've also done a little bit of health teaching with the family as far as ways to move her that will be less painful and ways to move her without her daughter damaging her back. We identified one underage marriage and referred her and her husband to the Kukuo elders and to the Kukuo councilman to make sure that it's not a forced marriage, and also to ensure that this young woman is able to continue her education and at least finish high school. Also to make sure that it's not a forced marriage. And we identified 4 girls who were pulled from school to support their families by working. 3 were farming and 1 is a tailor. And we have referred them to the Kukuo councilman and also to the Complementary Basic Education project that works with Nanumba South. So it's been a very busy 2 months.
Yeah, I'll say. So you said it's about a little more than halfway done, right? 595 screens out of approximately 1,200 in the community. That's if you count the tag-along family members who come in to take advantage,
That's
right?
if you don't count the tag-along family members.
Okay.
We have noticed that a lot of people that normally live in surrounding communities are now suddenly living with their families in Kukuo.
Well, hey, ultimately we're trying to increase access to healthcare, right? So no big deal there.
Yep.
But funding is a concern, and so we're more than halfway done, or about halfway done. And what percentage are we funded?
We're about 20% funded with our Razoo fundraiser at this point.
Okay, so just to refresh there, by putting Rebecca in place, the Humanist Service Corps has been able to actually put together a highly efficient approach to this medical records project. Because Rebecca's been here and has been able to train the locals and has been able to identify the best paths forward, we're able to provide these free screenings and to implement this entirely new record system for only $5,000. Although there have actually been some budget areas that have expanded for contingency reasons or for surprise reasons, but really $5,000 to $5,500, $6,000 for more than 1,000 free health screenings and an entirely new medical record system that was going to dramatically increase health outcomes for an entire community. That's pretty ridiculously cheap.
Yes.
But we're only 20% funded, and we need your help. So anyway, there's going to be a link below this video for more information about our medical project and for a chance to donate to our Razoo fundraiser for the project. But that's not even all that this project has accomplished so far. I mean, we're doing major outreach to an entire community. So what else have we been able to do?
Well, if you've got to talk to everybody in the community, you might as well take a census while you're at it. So the Nanumba South District has for a while wanted to establish birth and death records and a census in every community in Nanumba South. Unfortunately, that's just kind of fallen by the wayside, never got picked up. So Kukuo will be the first community that will have a full census with everybody's date of birth and age, what tribe they're originally from, what their occupation is, all that sort of thing. We're making a digital and a paper copy in Dagbanli and in English. And then we are also taking birth and death records starting from January 2016. And the 6 Kukuo health screeners that I trained to do the health screenings are also in charge of that. So that knowledge will stay within the community and will be able to be passed on to other people within the community even after HSC is long gone from this area.
Now there's some other knowledge that's staying in the community now as a result of your work too, right? I mean, we have this issue where nearly 10% of the community is showing positive results for the malaria virus. And that's only going to expand as the rainy season comes and as mosquitoes bite people and then bite other people. So what have we done there to expand knowledge in the community?
Well, we actually had a health teaching day in English and in Dugbanley. The local councilman was kind enough to translate, and we talked about the 5 different kinds of plasmodium that can cause malaria, how it's transmitted, um, ways to control mosquito population so that there's less mosquitoes to possibly bite you. Also, the importance of getting treated for malaria immediately, both for the individual, because there's 5 different kinds of plasmodium. 1 of them does not harm humans. 3 of them make you sick but won't kill you. 1 of them will kill you in a week, and there's no way of testing with a rapid test to know which kind of plasmodium you have. So it's important to get treated as soon as you know that you have malaria so that you don't die from malarial meningitis if you get the type 1. It's also important because as a person with malaria in the bloodstream, if a mosquito bites you and then bites another person, the other person is much more likely to get malaria.
And we needed to make that clear because a lot of people in the community won't seek treatment immediately because it, costs money. It's expensive, especially if you're going through the clinic. It costs even more money. Although there are some pharmacists in this northern region who will write you, well, not write you, they'll just give it to you without a prescription. But anyway.
There are also some non-pharmacists who will just go and get random meds and give you whatever. So we also, in our health teaching, we took the time to go through the 5 major medications that are available for malarial treatment in the northern region, the effectiveness of each, how many pills do you need to take, how often do you need to take them, how many days do you need to take them for, what is the cost, and we made a small card to give out to every person in Kukuo so that they have that information readily available to them if they were to need to get a hold of that medication for any reason. We do try to encourage them to go through the Ghanaian Health Service, but people without insurance, if you have to pay 30 cedis versus paying 2 cedis, it's a huge, huge difference for a lot of people.
Well, that's going to have to be all for us this time, but I think we already threw enough information at you, and I'm sure that we've convinced you that this medical records project we have going is just pure awesome. I don't know how you could not be blown away by what Rebecca and the Kukuo volunteers are doing. So I do encourage, beg, plead, entreat you to donate to our fundraiser below. We really are having an incredible impact on the Kukuo community, and it is an impact that will be sustained over time. But we can't continue it. I'm serious about that. At 20% funded but already 50% completed, we may have to consider putting this project on hold or I don't know, pursuing grant-type funding or something. If I don't know how long that will take. But we really, really, really need your help in order to continue this work, and it's work that needs to be continued. So anyway, I hope we've convinced you. If not, tell me why in the comments, and I will respond and try to convince you even harder. Anyway, that's all for this time. Until next time, bye-bye.